ഹലോ ഫ്രണ്ട്സ്, എല്ലാവർക്കും നമസ്കാരം. പുതിയൊരു വീഡിയോയിലേക്ക് ഏവർക്കും സ്വാഗതം. ഇന്നത്തെ നമ്മുടെ ഫസ്റ്റ് ക്വസ്റ്റ്യൻ, ഗോൾസ് ഓഫ് ഡയബറ്റിക് മെൽറ്റസ് മാനേജ്മെൻറ്റ് ഇൻക്ലൂഡ് ഡാഷ്. ഓപ്ഷൻസ് ആർ reduce onset of complication, control symptoms of diabetes, near normal glycemic control and HbA1c. Option D, all the above, that is option A, B and C. Here the correct answer option D, that is option A, B and C are the goals of diabetic mellitus management. Here what do you mean diabetes mellitus? Diabetes mellitus is commonly known as diabetes. It is a metabolic disease that causes high blood sugar. The hormone insulin moves sugar from blood into our cells to be stored or used for energy. With diabetes, our body either does not make enough insulin or cannot effectively use the insulin it does make. Normally, diabetes are categorized into 4 types: type 1 diabetes, type 2 diabetes, pre-diabetes and gestational diabetes. Type 1 diabetes is an autoimmune disease. The immune system attacks and destroys the cells in pancreas that are beta cells in islets of Langerhans. These cells are responsible for insulin release in response to food. Type 2 diabetes occurs when our body becomes resistant to insulin and sugar build up in our blood. What do you mean by pre-diabetes? This is not a disease condition, it is a warning sign of diabetes. Pre-diabetes occurs when our blood sugar is higher than normal, but it is not high enough for a diagnosis of type 2 diabetes. Gestational diabetes is high blood sugar during pregnancy. Insulin blocking hormones produced by the placenta causes this type of diabetes. The general symptoms of diabetes include increased hunger, increased thirst, weight loss, frequent urination, blurry vision, extreme fatigue, sores that do not heal. In addition to the general symptoms of diabetes, men with diabetes may have a decreased sex drive, erectile dysfunction, and poor muscle strength. Women with diabetes can also have symptoms such as urinary tract infection, yeast infection, and dry and itchy skin. Most women with gestational diabetes do not have any symptoms. The condition is often detected during a routine blood sugar test or oral glucose tolerance test that is usually performed between the 24th and 28th week of gestation. In the case of type 1 diabetes, doctors do not know what is the exact cause of its occurrence. They concluded that our immune system mistakenly attack and destroy insulin producing beta cells in pancreas. Genes may play a role in some people. It is also possible that a virus sets off the immune system attack. Nowadays, it is clearly found that the virus that causes COVID-19 can directly attack insulin producing structures in pancreas, and that can cause diabetes. Type 2 diabetes is caused by a combination of genetics and lifestyle factors. Being overweight or obese increases our risk factors. Carrying extra weight, especially in our belly, make our cells more resistant to the effect of insulin on our blood sugar. This condition runs in families. Family members share genes that make them more likely to get type 2 diabetes and to be overweight. The causative factors of gestational diabetes is as a result of hormonal changes during pregnancy. The placenta produces hormones that make a pregnant woman's cells less sensitive to the effect of insulin, and this can cause high blood sugar during pregnancy. Women who are overweight when they get pregnant or who gain too much weight during their pregnancy are more likely to get gestational diabetes. In conclusion, both genes and environmental factors play a role in triggering diabetes. In pharmacy practice, as a pharmacist, we should take care of the patient and practice our responsibilities towards the community. Pharmacists should ensure about the appropriateness of the pharmacotherapy plan, and in addition to that, pharmacists should counseling the patient about the diabetes complications. We should advise the patient to take care with diabetic medications and diet control. Otherwise, high blood sugar damages our organs and tissues throughout our body. The higher our blood sugar is and the longer we live with it, the greater our risk for complications. Complications associated with diabetes include heart disease, heart attack and stroke, neuropathy, nephropathy, retinopathy and vision loss, hearing loss, food damage such as infections and sores that do not heal, skin conditions such as bacterial and fungal infections, depression and dementia. Uncontrolled gestational diabetes can lead to problems that affect both the mother and baby. Complications affecting the baby can include premature birth, higher than normal weight at birth, increased risk for type 2 diabetes later in life, low blood sugar, jaundice and stillbirth. Diabetes can lead to serious medical complications, but we can manage the conditions with medications and lifestyle changes. Doctors treat diabetes with a few different medications. Some of these drugs are taken by mouth, while others are available as injections. Insulin is mainly used for the treatment of type 1 diabetes. It replaces the hormone our body is not able to produce. There are 4 types of insulin that are most commonly used. They are differentiated by how quickly they start to work and how long their effect lasts. They are rapid-acting insulin, short-acting insulin, intermediate-acting insulin and long-acting insulin. First one is rapid-acting insulin. It starts work within 15 minutes and its effect lasts for 3 to 4 hours. Second one is short-acting insulin. It starts its work within 30 minutes and its effect is last for 6 to 8 hours. Next one is intermediate acting insulin. It starts its work within 1 to 2 hours and lasts for 12 to 18 hours. Fourth type is long acting insulin. It starts its work within a few hours after injection and lasts for 24 hours or longer. Second type of diabetes is type 2 diabetes. Diet and exercise can help some people to manage type 2 diabetes. If lifestyle changes are not enough to lower our blood sugar, we will need to take medications. Blood sugar lowering agents used for the management of type 2 diabetes are alpha glucosidase inhibitors, biguanides, DPP-4 inhibitors or dipeptidate peptidase 4 inhibitors, glucagon-like peptides, meglitinides, SGLT2 inhibitors or sodium glucose cotransporter 2 inhibitors, sulfonylureas and thiazolidinediones. First one is alpha glucosidase inhibitors. It acts by slow breakdown of sugars and starchy foods in our body. For example, agarose and miglitol. Biguanides act by reducing the production of glucose in our liver. For example, metformin. Mechanism of DPP-4 inhibitors is to increase incretin level, that is GLP-1 and GIP level, which inhibit glucagon release, which in turn increases insulin secretion. decreases the gastric emptying and decreases blood glucose level. For example, linagliptin, saxagliptin and sitagliptin. Glucagon-like peptide 1, that is GLP-1, released from gut enteroendocrine cells that controls meals-related glycemic excursions through augmentation of insulin and inhibition of glucagon secretion. GLP-1 is also inhibit gastric emptying and food intake. Actions maximizing nutrient absorption while limiting weight gain. Medicines are dulaglutide, exenatide and liraglutide. Next one is meglitinides or glycinides. These are based on the sulfonylurea moiety of glibenclamide. They bind to the sulfonylurea 1 receptors on the beta cells, although with lower affinity than sulfonylureas, and stimulate insulin release in the same way. That is, it stimulates our pancreas to release more insulin. Examples are natiglanide and ripraglanide. SGLT2 inhibitors function through a novel mechanism of reducing renal tubular glucose reabsorption, producing a reduction in blood glucose level without stimulating insulin release. Other benefits may include favorable effects on blood pressure and weight. The drugs are canagliflozin and dapagliflozin. Next one is sulfonylureas. Sulfonylureas and meglitinides directly stimulate release of insulin from pancreatic beta cells and thereby lower blood glucose concentrations. Because they work by stimulating insulin secretion, they are useful only in patients with some beta cell function. Adverse effects may include weight gain and hypoglycemia. Examples are glyburide, glipizide and glimepiride. Next division is thiazolidinediones. Thiazolidinediones or glitazones. These are a new class of drugs for the treatment of type 2 diabetes. They bind to peroxisome proliferator activated receptor gamma in adipocytes to promote adipogenesis and fatty acid uptake. It is in peripheral but not visceral fat. Examples are pioglitazone and rosiglitazone. Here next question, what first line agent may be considered for an obese type 2? Here the options are glyburinide, insulin, metformin, natiglinide. Here the correct answer, option C, metformin. Almost 90% of people with type 2 diabetes are overweight or obese. Obesity causes increased levels of fatty acid and inflammation, leading to insulin resistance, which in turn can lead to type 2 diabetes. Metformin is indicated as the first line agent for obese patients with diabetes, and although metformin is considered to have weight neutral effect. Next question, these are non-aqueous pharmaceutical solutions. Options are option A, otic solutions, mouthwashes and nasal solution. Option B, essences, collodiones and elixirs. Option C, gargles, douches and irrigation solutions. Option D, syrups, mucilage and collodiones. Option E, enemas, liniments and spirit. Here the correct answer, option B, essences, collodiones and elixirs are non-aqueous pharmaceutical solutions. Next question, which of the following drug exhibit dose-dependent pharmaceutical therapeutic doses? Option A, sodium valproate. Option B, phenytoin. Option C, lithium. Option D, quinidine. Option E, carbamazepine. Here the correct answer, option B, phenytoin. Phenytoin is a anti-epileptic or anticonvulsant drug. It can be used to treat trigeminal neuralgia. It is a type of nerve pain that affects our face. Phenytoin is available only on prescription. It acts by causing voltage-dependent block on voltage-gated sodium channels. This block sustained high-frequency repetitive firing of action potentials. Next question, propranolol is often prescribed with the hydrolyzine to dash. Option A, reduce the reflex tachycardia. Option B, prevent accumulation of hydrolyzine. Option C, prevent systemic lupus due to hydrolysis. Option D, prevent edema. Here the correct answer, propranolol is often prescribed with the hydrolyzine to option A, reduce the reflex tachycardia. Propranolol is a beta blocker. Beta blockers affect the heart and circulation of blood flow through arteries and veins. Propranolol is a non-selective beta receptor antagonist. This means that it does not have preference to beta 1 or beta 2 receptors. It competes with sympathomimetic neurotransmitters for binding to receptors, which inhibit sympathetic stimulation of the heart. The combined use of propranolol and hydrolyzine may be purposeful not only to achieve improved blood pressure control but also to diminish the side effect of each drug. Propranolol is used to treat tremors, angina or chest pain, hypertension or high blood pressure, heart rhythm disorders and other heart or circulatory conditions. It is also used to treat or prevent heart attack and to reduce the severity and frequency of migraine headaches. Next question, the ability of a liquid to dissolve is dash. Ability of a liquid to dissolve is, here the correct answer, miscibility. Option B, miscibility. Here option A is hydrophilicity. What do you mean hydrophilicity? Surfaces that attract water are termed hydrophilic. The degree to which the surface attracts water can be termed as hydrophilicity. Some of the most common examples of hydrophilic substances are sugar, salt, starch and cellulose. Hydrophilic substances are polar in nature. Okay, then what do you mean hydrophobicity? Surfaces that repel water are termed as hydrophobic. The degree to which the surface repel water can be termed the hydrophobicity of that surface. Examples of hydrophobic molecules include the alkanes, oils, fats and greasy substances in general. Hydrophobic materials are used for oil removal from water, the management of oil spills and chemical separation process to remove non-polar substances from polar compounds. Some more points are there. What do you mean immiscible liquids? Immiscible liquids are those which won't mix to give a single phase. Oil and water are examples of immiscible liquids. One float on the top of other. Last option is solubility equilibrium. Solubility equilibrium is a type of dynamic equilibrium that exists when a chemical compound in the solid state is in chemical equilibrium with a solution of that compound. The solid may dissolve unchanged with dissociation or with a chemical reaction with another constituent of the solution, such as acid or alkali. Next question, which of the following is not correct? Option A, glitazones are ineffective as monotherapy. Option B, GIT or gastrointestinal tract disturbances are common side effect of glycosidase inhibitors. Option C, start with a small dose of oral agent and triturate up to 1 to 2 weeks. Option D. Lifestyle modification should not be enforced if an oral agent to be started. Option E. Lispro is rapid-acting insulin to be dosed immediately before meals. All these statements are related to diabetic management or anti-diabetic treatment. Here option D, lifestyle modification should not be enforced if an oral agent to be started. It is not correct. Because an active lifestyle helps us to control our diabetes by bringing down blood sugar. It also lowers our chances of getting heart disease. It can also help us to lowering our stress. Next question, in CHF management, the following is not correct. Option A, ACE inhibitors such as lisinopril improves left ventricular function and reduced mortality. Option B, blockers such as carvedilol may have beneficial effect in selected patient. Option C, spironolactone should be avoided because of the greater risk of hyperkalemia. Option D, non-drug therapy includes appropriate fluid and dietary sodium restriction. Option E, symptomatic improvement is one of the major assessment criteria for proper therapy. Considering CHF management, the incorrect one is option C. Spironolactone should be avoided because of the greater risk of hyperkalemia. Spironolactone are used in CHF to promote cardiac contraction. This is a familiar diuretic. It has taken on new life as a treatment for left-sided congestive heart failure. It antagonizes the effect of aldosterone and can lead to a reduction in fibrosis and an improvement in left ventricular function. Spironolactone has been shown to decrease mortality in such patients. Next question, which of the following is not a primary literature? First option, Journal of Pharmacy Practice. Option B, Applied Therapeutic and Clinical Use of Drugs. Option C, New England Journal of Medicine. Option D, Lancet. Option E, JAMA. Here the correct answer. Option B, Applied Therapeutic and Clinical Use of Drug. Next question, references to check compatibility of drugs in parenteral administrations. Option A, Merck Index. Option B, Handbook of Injectable Drugs. Option C, Micromedics. Option D, option B and C. Here the correct answer, option D. That is, option B and C are correct. Next question, when a CNS depressant is prescribed, in which of the following is not taken at the same time? Option A, analgesic. Option B, verapamil. Option C, aspirin. Option D, diphenhydramine. Here the correct answer, option D, diphenhydramine. Because diphenhydramine also has CNS depressant effect. Next question, a 4 mg dose of lorazepam administered to an adult will act as dash. Option A, analgesic. Option B, hypnotics. Option C, diuretic. Option D, antihistamine. Here the correct answer, 4 mg dose of lorazepam administered to an adult will act as hypnotics. Next question, drug of choice to control pain during acute myocardial infarction is dash. Option A, naloxone. Option B, pethidine. Option C, morphine. Option D, celecoxib. Here the correct answer, option C, morphine. Next question, what is a major contraindication to use an OTC sympathomimetic drug? Option A, gastric ulcer. Option B, uncontrolled hypotension. Option C, severe asthma. Option D, rheumatoid arthritis. Option E, hypertension. Here the correct answer, option E, hypertension. Because sympathomimetic causes increase in blood pressure. Next question, what advice would you give to a patient prescribed rifampicin as a pharmacist? Option A, take this medication with food or milk. Option B, avoid multivitamin preparations during treatment. Option C, avoid taking paracetamol during treatment. Option D, possible discoloration of skin. Option E, this medication may cause discoloration of urine. Here the correct answer, rifampicin may cause discoloration of urine. Next question, the correct method of parenteral administration of potassium is dash. Correct method of parenteral administration of potassium is slow IV injection. Next question, which route of administration would provide the most rapid onset of action response to morphine? Here the correct answer, option C, IV administration. Next question, the long-term administration of thiazide diuretic requires dash. Here the correct answer, potassium ions. Option A, K plus ions. This is because lupin thiazide diuretic increases the sodium delivery to the distal segment of distal tubules. This increases potassium loss that may cause hypokalemia. Next question, when considering drug therapy for hypertension, which is true? Option A, combination of drugs always preferred. Option B, hydrolysine is first line therapy in young hypertension. Option C, furosemide should be administered before meal to improve absorption. Option D, beta blockers should be avoided in asthmatic patient. Here the correct answer, option D, beta blockers should be avoided in asthmatic patient. Next question, which of the following is not used in theophylline toxicity management? Option A, symptomatic control of seizures with benzodiazepine. Option B, activated charcoal to enhance elimination. Option C, beta blockers for tachycardia. Option D, control vomiting with metoclopramide. Option E, methylphenidate to reduce excessive sedation. All these statements are correct considering theophylline toxicity management, excluding methylphenidate to reduce excessive sedation, that is option E.